All right, so we're looking at the right arm of a patient that's got essentially a posterior osseous nerve palsy. This is MR neurography performed by the Hospital for Special Surgery. These are axial images of their specialized sequences. So right now we are in the distal brachium. Here's the humerus, here's the lateral face of the humerus, here's the radial nerve. So as we roll down, we see normal appearing radial nerve here. We can see some of the fascicular architecture of the nerve. And as we roll down, we're going to see a little target appearance here. And then boom, that's that constriction right there. And then when we get to the other side, it normalizes back up. So if I roll through that again, normal, constrict down, and then it comes back up to the end here. So that's the first point of constriction. And as we follow it down further, as we get to where the nerve starts to branch into the deep branch and the superficial branch, as we come down, there's a second point of constriction right there. So I'll roll through that again, constricts down, dilates back up. So here I am proximally. So roll through, constricts down, boom, and dilates back up. That's the second point of constriction. So two separate points of constriction along the radial nerve. And as I roll down, you can see that then comes down. This is the deep branch of the radial nerve, relatively normal appearing here, and then as it dives into the supinator, so this is the arcade of Frosch right there, right as it goes right there. So now we're in supinator, and you can see the enlargement and the hyperintensity of the signal of the posterior osseous nerve within the substance of the supinator here. So once again, now going backwards up through the nerve. So now we're following it retrograde, supinator, back up under the arcade, follow it there. There's that constriction point. I'm going to roll through that again. So there's that constriction point right there. Boom. Right there. You can see that nerve kind of getting smaller and then larger. Larger, smaller, larger. There's that second constriction point, and as I keep rolling proximally, follow that nerve right there as I keep rolling proximally. There's that constriction point again. Right there. That's the upper point there. And as we keep rolling proximal, we get back up into normal nerve again. So now going fast through all of it. And there. And there. There.